Hello and welcome to another session on health education by Diagnostic. Diagnostic tests are an important tool for identifying and diagnosing medical conditions. They can help to provide insight into a patient's symptoms, confirm a diagnosis, or monitor the progression of a condition. Preparing for a diagnostic test can help to ensure that the test results are accurate and that the patient is as comfortable as possible during the procedure. The first step in preparing for a diagnostic test is to understand the purpose of the test, what it involves, and how it will be performed. The patient should also be informed about any specific preparation instructions, such as fasting or not drinking or eating before the test. For some tests, such as imaging tests like X-ray, CT scan or MRI, the patient may be asked to remove any metal jewelry or clothing items that may interfere with the test. Some tests may also require the patient to change into a gown. It's also important to inform the healthcare provider of any medications that the patient is currently taking, as well as any allergies or medical conditions that the patient has. This information can help the healthcare provider to determine if any adjustments need to be made to the test or if there are any risks associated with the test. During the test, the patient may be asked to lie down or remain still for an extended period of time. Some tests, such as endoscopy or colonoscopy, may cause some discomfort or mild pain. It's important for the patient to inform the healthcare provider if they experience any discomfort or pain during the test. After the test, the patient may be given specific instructions regarding post-test care, such as how to care for the area that was tested or if there are any restrictions on activities. The patient should also be informed about when the test results will be available and if there are any follow-up appointments that will be required. In conclusion, preparing for a diagnostic test is an important step in ensuring that the test results are accurate and that the patient is as comfortable as possible during the procedure. It's essential to understand the purpose of the test, what it involves, and how it will be performed. Patients should also be informed about any specific preparation instructions and should inform the healthcare provider about any medications, allergies, or medical conditions they have. During the test, patients should inform the healthcare provider if they experience any discomfort or pain. After the test, patients should follow any post-test care instructions and should be informed about when the test results will be available and if there are any follow-up appointments that will be required. By following these guidelines, patients can ensure that they are as prepared as possible for their diagnostic test and can feel more at ease during the process.